Now we will start to examine the lower limb arterial system by examining the aorta. That means we should examine the aorta before going to examine the lower limb. So that, how to examine the abdominal aorta by Doppler? Starting by transverse perpendicular in the midline, going directly here. You can see the aorta and superior mesenteric artery, superior mesenteric vein, and this is the IVC, and this is the spine. Scanning of these vessels transversely perpendicular like that from upwards, downwards until it bifurcates is very important. For what? For excluding the aortic aneurysm. By this scan, quick scan, I'm excluding the aortic aneurysm. How? Look to this. We can measure. You have two ways. First way, you can measure the anteroposterior diameter of the aorta, which is 1.6 centimeter, and this is considered normal. You have another way which is considered subjective, like what? Try to measure by your eye. This is the spine, and the aorta is less than the spine. Whenever the aorta is less than the spine, that means it has no aortic aneurysm. This is by B mode, okay? Let us to go to color. Second step, to assess the aorta, to check the spectral wave form of the aortic flow. Here, I will pick the good area away from gases by transverse, then make longitudinal, perpendicular first. Now you can see the aorta longitudinal. Adjust the machine, adjust the depth. You can adjust the depth like this or like this. I'm seeing the aorta is clear with no any gross significant echogenic material or any gross aneurysm. After finishing this stage, directly try to make cephalic angulation like this. You can lose some of the aorta, but by sliding downwards little bit to check the aorta at this region. All of these actions are made to make a good angle with the beam. This is the beam and this is the aorta. Aorta is curved like that or angulated. Then apply the color. If you apply the color, don't put it like this. Here I am 90 degree. The beam is running like this, 90 degree with the axis, so that I should take the box in this angulated area, cephalic area, and the color will appear. Then apply the spectral sample volume and the pulsed wave Doppler by slight pressure with the probe, more angulation. You can get a good spectral study. Update to see the picture like that. This is the normal triphasic aortic flow. Normal triphasic aortic flow. What its indication? It indicates the window is still present. There is no increased velocity. This pushed me to measure the velocity. Let us to see the velocity how much. The angle bar is within the axis, then the velocity will be about 90 centimeter per second, which is considered normal. And this is accurate way of measurement of the velocity. The triphasic study like that, the triphasic waveform like this, indicates what? Indicates that the area we are measuring here is totally free with no significant stenosis or occlusion. Also the area before, also the area distal, at least 10 centimeter before and 10 centimeter distal. That means this aortic flow is considered normal, and then I will jump directly to check the common femoral here and common femoral here. If they are triphasic, that means the area between the aorta and the femoral are completely free of stenosis and free of what? And free of significant stenosis or occlusion. One more issue you can directly go back to check it, which is if there is any aneurysm in the external iliac vessels or either left or right, this you should examine. Here are the vessels. You can check also the vessels like that. Both iliac vessels are good. Now there is no aneurysm here on the right side, and on the left side also by the transverse angulation downwards, angulation upwards, all vessels are running well. This is the arterial and this is the venous. You can make longitudinal study. If there is no gases, you can apply the spectral analysis here. We'll check the type of waveform. By the type, you can know that this is normal or abnormal. This is an artifact, don't worry. Try to adjust your hand again, like that. Here, we can see this is considered abnormal. No. You should check your technique 1, 2, 3 until 4 times or 5 times. You can check the technique. Look, when we apply the good angle, not the angle bar, good angle between the beam and the axis of the vessel, you will see how much the flow will be better. The flow will be better like that. This is triphasic flow, which is very good and normal. On the left external iliac, excluding aneurysm, its normal velocity also is still going down less than aorta. Triphasic waveform, all of these are normal. Until now, the external iliac is normal. Go to the right side also. Again, to the right side, this is the iliac vein, and this is external iliac artery. I'm making a longitudinal, then cephalic angulation to have a good. Don't put the beam here. Try to put it in angulated region to get a very good spectral flow like that. Look to the flow. It will be more better. When you apply the technique well, you can get what you need well. You can get an accurate measurements and an accurate diagnosis by good technique. Until this, I'm sure that there is no any aortic aneurysm or any aneurysm in the iliac vessels, and I'm sure that the triphasic flow is here, triphasic flow is here, triphasic flow is here. All of these excludes aneurysm, excludes any significant stenosis or any occlusion in the arterial tree. Then we will go and jump to the femoral regions on both sides. Thank you.